welcome to the second episode of the McGill Medical and Dental Student Podcast. I'm one of your hosts, Amy, DMD3.
Bonjour, je m'appelle Maya, je suis en première année en médecine ici à McGill et bienvenue au deuxième épisode de notre podcast. On est très heureux de vous avoir.
We're very excited to be introducing our second guest, Dean Emami from the Faculty of Dentistry. Dean Emami was appointed as the Dean at the Faculty of Dentistry back in 2018. She holds many executive titles with the university, as well as at the provincial, federal, and international levels. She originally practiced back in Iran before immigrating here to Canada. She has a postgraduate professional training in Prosto from Université de Montreal. She also has research training in biomedical science, which was a joint program with McGill as well as Université de Montreal, a dental public health postdoctorate fellowship here at McGill University, and a cancer epidemiology postdoctoral fellowship from Université de Montreal. Dean Emami, thank you so much for being here today. We're so excited to have you.
Thank you very much. And hi everyone. Bonjour tout le monde. Je suis très contente d'être aujourd'hui ici et avoir cette discussion avec nos étudiants en médecine et médecine dentaire.
We hope today to really dive into topics that are really relevant to dentistry, but to really get to know our Dean on a more personal level. Dean Emami, just to get right into it, what was your journey into dentistry?
I had and still have a very joyful and full of excitement journey in dentistry. So I graduated from a Catholic French school about 40 years ago. And at that time, I applied to some universities around the world. So in France, United States, and Iran. And I wanted to continue really in health sciences. So my preferences was dentistry, medicine, and then maybe pharmacy. So I wanted to be in health science. Then I accepted actually in Université Paris in medicine and dentistry in Iran, and then some few others also around the world. But I decided actually to defer my medicine for 1 year, which was from France, and continue in Iran my dentistry. So I started my journey in dentistry as this. However, after 1 year, the university was closed because at that time we had like an educational reform following the revolution of Iran. So, and then I decided to go back to Paris and continue in medicine. And I went there, I studied medicine, and so it was a different environment, but I enjoyed a lot. And at that time, actually, the war of Iran started. And so you can see I was very young and very worried about my family. And after a while, I wanted to go back to Iran, be with my family, because I was very stressed. And unfortunately, also at that time, my brother was actually called mixed in series, and so then I thought that I had done a very good decision to be with my family at this hard time.
Definitely.
I continue, and then I finished my DDS program there, and I was actually the top student of my cohort. In general, I was quite a nerd student, but at the same time, I was very adventurous. I am somebody that I like to do different thing at the same time. So although I was a nerd, but still I was doing other things, but at the same time I was reading my things and so on. So I had been always a first student during my schools.
I have a question for you, actually. When you were debating between the both, when you were thinking of, I want to be in the science field, what made you navigate more towards, in the end, focusing more on dentistry, and that you started that journey into dentistry versus any other professions?
Dentistry for me had some advantage, and still I think this is dentistry because it's not only science, you have art on this as well.
Definitely.
But you work with your hand. I like painting. I was doing painting when I was young, and so and it's different. You can do different things. You can go to the business of dentistry. You can go to the academics. That is also for other field, but it's still for dentistry is different. For example, than medicine. If I want to compare you can actually be a generalist without and be very comfortable with this as opposed to medicine that you normally want to do a specialty. And within like being a woman also sometimes is easier because you can manage your time if you are in your private practice. It is manageable. So I remember the days that my daughter, she had exam. I always close my clinic to be with her and
Oh,
practice with her. So I think this about that you can do in dentistry. You can do in dentistry. But with medicine, I think it's harder. And then anyway, when you go to the health sciences, these are the two that normally we are more attracted, and I like it. I think pharmacy also. I was good in um, on this aspect, but maybe also is a system that when you go through at Iran at that time was like that. You if you are in health science, you have a grade. Always medicine is harder to get in than dentistry and this. So and you go also by this kind of selection because you want to go to the best one. Maybe sometimes it's like this.
right,
But I
right.
like dentistry because mostly of the aspect that I mentioned to you.
Definitely. That makes a lot of sense.
Perfect. And we had another question actually. What were the challenges that you faced as a foreign trained dentist coming here and being a dentist and your tremendous career that you had?
Uh, Being a foreign trained dentist, and then you face many challenges. First of all, immigration per se is a hard process. It's not easy. You have to prepare yourself. I remember when I decided to come to Canada and to Montreal. At that time, it was 2002, and still in Iran, computer and etc. was not something that we were doing routinely. So I have had to learn at that time how to use computer, go search, and I remember that I searched uh, all of the neighborhood of Montreal. I searched the best school to the Montreal. So for my daughter. So these were also my priority. And then, so I prepared myself. I think this preparation was very, very important because when I came to Montreal, I knew which quartier I want to live. I knew where is like maybe the school that my daughter will go, and all of this happened. My what I selected, although I didn't know at that time that it could happen, I realized it. So that is very important. I think self preparation, and I think we have also to decrease somehow our expectation from where we are going. We have to integrate in the culture and in society that we are going, because we are not invited to go there. We are immigrant. That means we want to go there. So, and I think this was very helpful for me. And I was lucky because when I immigrated to Canada, um, actually going back to my journey in dentistry, and after I finished my DMD program, I went at that time. I was lucky actually just after finishing my school, I met my husband, and he was also a doctor. Just he came back from United States. So we were both young, and we married together. And then we said, okay, where to go? And still the war was ongoing, and we decided to go to rural and very rural and remote, um, because we wanted to serve the population, and we wanted also to be in a different place, start our work and our life. And then after a while, he got accepted in a specialty, and we went back to Iran, to Tehran, and there I really took the responsibility of the life financially. So I work in many places, governmental, governmental clinic, industries, and then my own private practice. And one of the reason actually that we moved to Canada was because he did his specialty, and he and myself also always want to continue my education. So this is why we applied to Immigration Canada, and at the same time I applied to Université Montreal for residency program. And you can see, because my background was in French, I went to French school. So my second language was French, and I was looking for a French school. And Université Montréal had like the very good program in Prosto. So we came at the same, and I was lucky. Everything like happened in a good way for us. So when we got our immigration, at the same time, I had my admission for, not admission, but invitation to pass the exam. So
Okay.
I went there. I had at that time for foreign trained dentists, we had an exam. So full day, a full day exam, doing like working on mannequin, mounting it, the complete denture,
Everything I'm doing now.
exactly. And a treatment planning. I remember that was a very, still I remember, it was snowing very, very heavily. It was our first experience with snow in Canada. And it was actually Nowruz. It was March 21st, the day that
Oh,
I was
wow.
doing that. And I
Oh.
remember my interview was the last interview. So I went at that time. I asked the director of program, Pierre de Grandmont, that we missed him. We lost him last year. I said to him, can I be a little bit earlier in your process, because I want to go back. At that time, we were in Ottawa, because we just entered, and my cousin was in Ottawa, and they said yes. So short story, I was accepted at Université Montréal. So that means for me, I started my life in Canada with studying. And I enjoy it, because, as I said, I always like studying. So I enjoy it. But it wasn't very easy neither, because, I was trained in another system. I was working more than about 20 years in private practice, and then you go to a very hard program. Your language is not at this skill. I didn't know how to do a PowerPoint presentation. I remember the first time that they said, oh, you have to present by a PowerPoint presentation. I went to see one of my friend that was a student, and I said, can you show me how to do a PowerPoint presentation? But and I did it. I enjoyed it. So when I actually my environment was very young at that time. Dr. Abinader, that you know him, he's your associate dean. He was actually I think the head resident for us. So we were working together until, I don't know, 10 o'clock, 11 o'clock in lab. It was joyful, but you can see my environment were very young. young, but I at that time, I was, I think, about 40. So it wasn't very easy, but I passed my exam, my equivalency exam, and then I got my practice. But because during my prosto, I did a master, and I did it in microbiology, my study, my research. I really like research. I realized that I like research. So I decided to right away do a PhD. And then after finishing my PhD, I got my job at UDM. But at the same time, I got some award, CIHR Clinician Scientist Award. And that was, I think, I was the first Quebec dentist to get this award.
That's amazing.
Wow.
Yeah.
Wow.
So, and then I negotiated with the dean at that time, and I said, look, let me also do my postdoc. At the same time, I teach, I do my thing. I am multitask. I can handle both of them. So I did it, and then I become a clinician scientist. And I continue since 2 years, and yeah, it was 2 years ago, 2 years and a half ago. Then one firm sent me an email, called me and said, there is an opportunity at McGill University. Do you want to apply? And that actually, I reflect on that. And I at first, I didn't want really, because I haven't designed in my career plan to be an administrator. But then I called some of my friends that they were dean in United States, and I was in a leadership team in Prosto, and they said to me, Alame, a very learning experience for you. Do that. And I did it, and then I became a dean, the first woman dean at McGill University, and now I'm very, very proud.
What a beautiful accomplishment. And we are so happy to have you as our dean.
Thank
But
you.
now that you are dean, I think what people want to know is, do you still practice? Do you only do the administrative end of things, or do you still see patients of your own?
Yeah. I don't do private practice, but I do clinical teaching to maintain my hand. And also, I think it's very important that, as a dean, is good to be in the practice of dentistry as a dean of dentistry, because this is the only way that you see what are the needs of your students, what are the needs of your staff, what is the need of your professor. And the same thing for research. It's good to have a good knowledge and be in this environment as well. So this is why I didn't want really to finish my career as a clinician, although, because then you are very, very busy, and you have to put priority in priorities. And in Prosto, it's very hard to go to a private practice and have only half a day. And this is why I think for me, just being in a clinic as a clinical supervisor, it's good. It's no, it's good.
It's a way to wind down after a busy career.
Exactly. But you go as a dean, you are very, very busy as well.
Oh, yes.
But it's still, I think in every type of work that I have had within dentistry, I just enjoy it.
Mm-hmm. So talking about prosthodontics, one thing that's very popular nowadays, we see it in the media, some of our friends talk about this, is veneers. So everybody now is going to Turkey to get veneers. And or Colombia. Because it's cheaper. Obviously, veneers are very expensive if you get them here. And then they claim it's the best thing. Celebrities get them. I would like your personal opinion. I think everyone wants to know, but I would like your personal opinion about, are veneers good for you? Like, should we get veneers, or what's your opinion as a specialist?
So personally, I like natural and healthy smile. Like I think everything natural is more beautiful. But and I prefer to use veneers when they have their own indication. So this, and at the same time, many people still cannot afford basic dental treatment. So we have to see, should we really promote cosmetic dentistry or promote to access to care? These are the point that we should look at it, and we should think. As I said, I think um, uh, I don't promote to have full winners. Go to Turkey, go to this burden just for having a nicer smile. But when there is an indication, so we have to use it.
Okay. And also, I was again for the veneers. Some dentists actually do it without shaving down any of your teeth. So they put, I think it was like porcelain veneers.
Yeah.
From what I saw, is that dangerous for your health? Like in like 10-15 years, are you gonna have to shave down the teeth, or can you just keep like
Mhm.
replacing them without shaving down your teeth, without losing
Okay.
tooth
Okay.
structure?
So, when you look at the people who have this kind of veneers, you can see that they don't look at all natural, because and that also has an impact on the health of your gum, your periodontal tissue, because of this kind of because you don't have enough space. You have just put your veneers on your natural teeth without conserving your biological environment. So it's not good to do this. So we have, as I mentioned, veneers have their indication, and they have also the standard of how you do a veneer. So we have to follow. We have to follow. We cannot just make it as it. And this is why those people who are doing this, also they should have enough experience and for doing veneers. So yeah.
Okay.
I think it's like, the unrealistic standard of beauty that is being put in society, and that people see that I can get this perfect smile. And then you have these
Exactly.
consequences that come with it, right? Because it's indicated for everybody,
Yeah,
right?
exactly. And also, we are seeing that not only in dentistry, we see some people go to this very, very hard diet that they are not at all good for them,
Yeah, absolutely.
because everybody, wants to be like celebrities, etc., very thin.
Exactly. Yeah.
So, and I think, as I mentioned, we have to be healthy,
Hmm.
and the beauty, I think, comes with health, and be natural. This is my opinion. Maybe I am wrong.
Depends on the person, I think, but I agree. I think that what's healthiest for you is it's to keep what you have and to keep that healthy.
Exactly.
On to the next topic. So we have to talk about what's happening. The biggest thing that's happening to people right now is dealing with the COVID pandemic. Where we've already surpassed a year now that we've been in this pandemic here in Canada, and we want to know, how did COVID affect you personally,
Mm.
just as a person in your everyday life?
So I think with COVID, we all realize that we lack this social interaction in our life. That is very important, and this affects all of us. And I was used also to do lots of travels, and that also is different in my life, because that is something that I enjoy a lot, and even the type of the work that I have allow me to do this. So I miss this part as well. But personally, because I was so busy with managing the school and try to keep our environment healthy, and also we wanted that our students be graduated on time, we deliver our programs. So I have to work very hard, so that means I don't have time so much to think about the COVID neither. COVID keep us very busy, and I am coming also to the faculty. That's good. Still, I can go to the clinic see our students and our staff, and that is good. So I have had less kind of maybe this effect of mental health. But I know that was very, very important for us to keep also our students, our staff, their mental health in a good shape. But it's always we put the strategies in place. We try to keep really very open discussion with our students to see where they need. We address their needs. We put some workshops. I don't know if Ami, you had the chance to go to these workshops that we invited people. The people they were really in dentistry talk about mental health. So, and I think that was good for students, and also for the staff. We have had different and McGill actually had a different kind of workshop event and support for keep us healthy. So so far I think we haven't faced any major issue in our faculty. I'm very happy about this.
Okay. Well, that's good to hear that you've been keeping busy with the faculty and the curriculum. I do know that because dentistry involves a lot of clinical practice, the curriculum was modified quite a bit, I think. Was that like challenging to do? Did you have a decision that you were like, oh, we might have to postpone graduation, or how was like the process in coming? Like, because at one point we didn't know, right, if we could go back in person and do the clinical activities. Did you have those discussions? How did you guys go about that?
Okay. So in dentistry, actually, we had really drastic changes because, and I have to really congratulate my team, my associate, because they quickly adapt to the situation. So they went to remote learning for students and also remote teaching. And then they designed the curriculum in a way that even we have a lockdown for a few months, still we can actually go back to the normal somehow, not normal, but still we will be able to graduate our students, because the students in dentistry, they need some clinical requirements, because we have to make sure that when they graduate, they are good dentists, because they go right away and they have patients, so they have to do they have to be competent in their clinical task. And that was the priority of our faculty and our team. So we were able so far to graduate 40 students of graduate students of last year, and we hope that all of our students will be graduate this year as well. So far, I have heard from the curriculum committee and the promotion committee that everything is going well. But we could have always surprises and challenges. Always you face challenges, but I think we have to find immediate solution, and then see in a short term, midterm, and long term what you want to do. And this is what we did with our team. And having a good team and also good students that actually they were very, very collaborating. That is important, because if the students don't follow the rules, the protocols, would be very difficult to control the situation. But our students, they're so good, they really follow all of the safety instructions.
I'm like, thank you so much.
I know, and that is, that help us. We didn't have any problem with our students, but many universities, I think they had some difficulty in this regard, but because we are also a small faculty, so it's like a family, and the discussion, and that's good. And I am very happy that so far everything is good. I will knock on the wood, but it's anyway. I have always this kind of not really a stress, but I want that everything will go well until that everybody get their vaccine, because then at this time we will be in a better situation when all have their vaccine. So
I know that like when it all started, we were in pre-clinic, us now DMD3s, and it was such a scary time, but we felt so supported because like every step of the way we knew that we were being heard. And then when we get back, we're like, it's scary, we're starting clinic, it's a whole new chapter. But it feels, and it's scary because it's happening with COVID, but the nice thing was that whenever we go to school, we feel very safe. And when I hear about just other schools or other places, I know that at McGill Dentistry, like we're taking every single precaution necessary for ourselves as well as our patients. And that is a very comforting thing, because that's something less that we have to stress about, right? Because we're doing this during a pandemic, and we're working in people's mouths all day long. And I think that's important. I just wanted to mention that we're able to go into school every day and feel safe. The downside for me is no one knows what anyone looks like anymore. This is my face, everyone. I'm Amy. No one knows it. Like, we have our demos and they know us by our eyes. They know us by our face shields with their names, and we're hoping for a better tomorrow.
Yeah, we can all hope.
Yeah.
Hopefully we will get the vaccine, and I think with this vaccination we'll be in a better shape. No,
Yes.
it's a stressful time because of these variants, and I hope that we will actually surpass this as well.
Definitely.
So we also wanted to mention about the Black Lives Matter movement that was very prominent last summer, and we were just like wondering your initial reaction when you saw all the protests and all the everything that was going on around the movement. What was your initial reaction?
Mhm. But I think my first reaction was a kind of self-reflection. I realized that as a dean of a faculty of dentistry, I need to be more proactive. Okay, and this is why I started by having action plan, and we didn't have any committee in our faculty. For the first time, we put a EDI committee in the faculty. We nominated chair, we nominated a co-chair, and then we did terms of reference. So I started by governance model, because when we start having a governance on a matter, that means how you take it. This is the way that you take it serious. It will become part of your committees, and it will stay forever there. So that, and then we started various activities, still ongoing, and our students, they are so proactive and they are good. So in the committee, we have many students that they are members of EDI committee, and we work together. And I'm very pleased that today, actually, I got a very good news that we got a grant, a McGill grant, to work on our EDI initiative. So we have had on this two main objectives, and one of them was to support our students, our initiative of our students. So our students are doing a mentoring program for high school students, and they will create their own website for this mentoring. And also we want to start by working on barriers to access to dentistry, and we will do some research with our graduate students, and now with the help of this grant we could recruit also an EDI officer that they can work with the team. And part of our programming is to go really to outreach and work, because our flagship of the faculty is the community services and outreach. So we want, and now we will do, and we have started. We have already had some workshop. We have already have some meeting with the representative of Black communities, and I'm really very proud of this. And if McGill actually, I would like to thank, because they are giving lots of support, and it is in the strategic planning also of the provost. So that's amazing. So now we are very happy that we are working on that, and we should advocate. We should be the faculty that advocate that across Canada and in the world as well.
Definitely, and I think it's beautiful that we're able to start working on such an important topic. But in addition to these mentoring programs, there is an underrepresentation of Black people in terms of the student body, the faculty at McGill, at the Faculty of Dentistry.
Exactly.
In addition to these mentoring programs, have we ever explored, a pathway, specific to Black students or anything like that in order to really promote the inclusivity into
So I didn't go to the series of our activities, but if you go on our website, that we have also created an EDI website on our website.
Cool.
We have actually put in place a pathway for Indigenous, and from last year the team, with the collaboration with the Faculty of Medicine and Health Sciences, they are working on the pathway for Black students as well. So this is already in place. We are working on that. But what we realize, we have to go to high schools, college, because we have also to help them to be capable to have the standards to come to the universities or to the dentistry, that it is hard to come to this program. So we have to prepare them. And this kind of mentorship is good for preparation. This is why we saw the necessity of this, but the pathway would be in place. It's not only our faculty, there is an underrepresentation of Black and Indigenous community in dental profession.
Definitely.
And there are different ways to work on it. And I really like to work. This is what some of my passion, to work on this. And that could be, as you mentioned, a strategic admission. We could start by having some, for example, outreach. For example, if I say Indigenous communities, outreach to the communities, because the students also should go in place and motivate and them, and then maybe in the future, if we have like a kind of residency program for rural, for Indigenous, so these are also the means of promotion to have more dentists from any like socio-cultural and ethnic group that we have a lack on this, and we will work on this. So yeah, we have quite a strong planning. The faculty committee, they will, one of their mandate is to work on their strategic planning, but already we have achieved lots of the initiatives that we put in place since last year. And I just sent my annual report to Provost Office for EDI activities, and we will post it online, and you will see we have worked quite a lot. And we recruited actually the first professor in a tenure track for our faculty from Black communities, and I'm very happy
That's
that
amazing.
yeah, that our
That is
professor,
great news.
yeah, that so this professor now she's a postdoc at McGill University, and she will come in September. And she's amazing researcher. She and her field of interest is teledentistry and digital technologies and outreach. So her license is for really outreach and innovation, digital innovation. So. Uh,
That's very exciting. That is very exciting, and many big steps being taken. That's amazing.
Yeah, I think we're both happy to hear that the faculty is taking like official steps, because you know, in the indigenous pathway, I think really helps a lot of indigenous students get into the medicine and dentistry program. And if you know, you just said that you guys are working on one for the Black community, and I think that's great news. Yeah.
I agree.
So also being the first woman dean of the Faculty of Dentistry at McGill University, that's a big, I think that's a big step. You know, I think that's amazing, and we hope that even more women become deans in the future. So we were just wondering,
Girl power.
yeah, we were just like wondering how can we continue to promote women in leadership, whether it's in, you know, dentistry or like medicine. We know there's a lot of women students, but when it comes to leadership roles, it's very rare. And just as, for example, you're the proof of that. You're the first woman, you know, dean of dentistry at McGill. So how can we promote that?
Okay. So, in fact, these recent policies toward diversity, equity, and inclusion have had a good impact also on the increased number of women that they are in leadership position. And also, I think we have to encourage the women to take leadership role. Because they have shown really their achievements, their way of doing the things, that it is different from men, and they are very multitask, and they have a talent in a long vision and a strategic planning. So we have just to encourage them, promote them when there is an opportunity, highlight to this opportunity exists, you can apply. And if they need some support for this kind of application, I think as leaders we should help them. And I'm happy actually in our leadership team at the moment. We have an equal number of men and women in the leadership team, so that's very good. And also in our faculty this year, some of our women professor, also obtain a leadership position in research across Canada. We have many leaders in our faculty that they are women, but we will do, I think as a woman dean, of course, that I would like to promote also women, and I'm addressing this. And we should also advocate. I think we should be vocal. We, as a woman, we shouldn't be shy. You know, we should go ahead and show that we can to go through. It's still around the world, including Canada, boys club are existing. So it's our role also to somehow start to change this boys club and kind of have a diverse teams in many in any aspects, not only in dentistry. So I think this has happened. I see across Canada now we have many women that they are dean at the faculties of dentistry. That's very good sign. That's a very good sign, and I am very happy to see that now we have this leadership in dentistry as well.
But Dean Emami, you've had such a successful career, and do you feel like being a woman has ever put you at a disadvantage? Have you ever, you know, been discriminated against as being a woman, or not been able to, you know, get certain opportunities or anything, and, you know, really just be put at disadvantage due to the fact that you are a woman?
Um, I don't think for me this has happened, but that maybe also could be related to my personal characteristic, because sometimes you don't allow also that this happened to you, or you go and you to achieve what you want. But I haven't really seen discrimination in my work environment in Canada. I can tell you, in Canada, I haven't seen that.
Yeah, because even when we speak about salaries, I know it's surprising to hear it, but even in Canada, men for the same job are still paid more than women. When we compare dollar
Mm,
to dollar, it's not equal. I think it's in like
mm,
the 60 cents for $1 that a man would get. It's just maybe like you said, like you don't see it because you had like a positive experience and such an amazing career. But
mm.
I'm glad that there's initiatives to promote women in
Exactly.
positions of
And
leaderships.
and the policy of addressing anomaly in salaries, at least I know it exists in McGill, and we are looking at this carefully. And if it is existing, we try really to address these anomalies. And yes, and for some jobs, I think yes, there is a difference between man and woman, and maybe because in academia, there is some base, and this is where in academia I think this gender disparity may be less, but that depends also on universities. I don't, but I think so far what I have faced, it wasn't any difference in terms of kind of base salary. It is all mostly based on your experience, based on your education and etc. But for some work, I agree with you. It is still exists because maybe the work of women are underestimated.
Mm-hmm. Yeah,
And I
definitely.
think dentistry has, as a profession, come such a long way because it was completely male dominated. Whenever I walk through the halls and I see the alumni pictures, they're all men. They're
Exactly.
all
Exactly.
men. And
Yeah.
now half of our class are girls. So
Exactly.
I think it's just like, breaking that down in society that females can also be dentists and we can be as good as dentists as men can be, right?
Yeah.
Better.
Okay, so now we're going to end the podcast on a lighter note. We're going to ask you some fun questions. So just whatever comes to your mind first, that's the answer we'll take. I'm going to start with the first question. If you are not a dentist, what would you be doing?
My second choice actually in go back to the time that I was selecting the things. I liked psychiatry within medicine
Psychiatry.
and the psychiatry, and I think that is still, I like to go to hospitals and help people that they are affected by mental health. And I think this is where if I have had the chance to be always young and do something different, maybe I have had continued on that.
Okay, perfect. And what is your favorite procedure to perform on a patient?
And dentistry,
Mm-hmm.
uh, class one restoration.
Me too. What is your least favorite procedure to perform on a patient?
To do root canal in very curved and calcified
Canals.
root, yeah, canals.
Okay. And we know you're a long way from your dental school days. So if right now you would ask to perform a cleaning on a patient, would you be able to?
Yeah, I could do that. I'm confident that I can do that. Yeah, and
Okay.
actually, because in Iran, in our practice, we used to do all of our clinic ourselves. As you know,
Oh.
when your practice was solo, and I was doing that for many years. So, and But this is a basic treatment, but here we have a very good dental hygienist that they can take care of this, and they are doing very well.
Definitely.
But in some countries, it's still dentists are doing their own cleaning, and so
I'm doing my own cleanings. um, what is your favorite hobby?
Uh, I like a lot interior design, and whenever I have time, sometimes I like to start a renovation project at my home. Not doing myself, but going to the renovation project because I really like interior design. I also like, I think that I can consider as a hobby, hanging out with friends. We used to receive lots of people at home, have big parties. I like it. I enjoy it, and also traveling. And this is something that I consider even as a hobby.
Mm-hmm. I think we all missed that because of COVID. Yeah. And then, what is one thing you missed about living in Iran?
I miss my friend and my family.
And the food?
The food, I can do myself, and now I am lucky to have my mom that now she's with me
Perfect.
for a while. So, and we have good restaurant, Iranian restaurant as well in Montreal and
We
in some
do.
other cities in Canada. So I can take that one. So that is not bothering me so much. I think it's really missing my friend and my family.
Mm-hmm. For sure.
Big question, cats or dogs?
Dogs.
What is your favorite thing about living in Montreal? Like, what do you really like about Montreal?
I like Francophonie, and also I like that Montreal has lots of restaurants. This is something that I like to discover every time a new restaurant in Montreal.
Mm-hmm.
That's our favorite pastime as well.
Yeah.
What is your your ideal vacation destination?
Uh, I like to go and travel around the world. So far I have seen many places. So I think I don't have like a favorite place. I like just to go where I haven't seen. And when I go to new places, new countries, new cities, what I'm really amazed is go to the communities, go for really local food, talk with people, take a bus, a local bus. But now where I haven't seen so far is China and India, and I think these are two places that I have to go. I have to plan and to go there.
Mm-hmm.
Maya, before you go, I just had a follow-up question. What's the favorite place you've been to up to now? Would you say? It's probably a hard question.
Uh, I like a lot. Japan was really a country that I was impressed by this country. The challenges that they faced, and then how they have actually maintained their tradition with technology, and that was for me amazing. So I would like to go back and maybe have a chance to be 6 months there. And I have a very good colleagues, prosto colleagues in Japan that the last time that I went, actually they show me part of Japan, and they were a very good host. So I have a
Aw.
very good memory. So I think I would like to go back there, and I like a lot south of France. That is also one of my favorite place. This is the only place that I like to go 2 times, 3 times. Uh,
Yeah, me
I like
too.
as well.
So let's say tomorrow you won the lottery, like a big amount. Would you still continue working?
Yes, I don't think that I really work because of having a salary. We all work for having like a means to for our life. But no, I like working. I like working, and until I don't get to my retirement, I think I will work. Even if I got a lottery, I will work. But I could do lots of things with lotteries. You can use the good things in your name, and then I could have lots of plan for a lottery.
For sure.
If you could live anywhere else in the world other than Montreal, where would you live?
Uh, my plan of retirement is this, so that will show how I want to do is to really go every 6 months to a new places. And this is how I see. I like changes, and family wise, my husband also we like change, and even during our work, although for example we were in Iran, we have moved from cities to cities, and it is good to it increase I think your knowledge your and so I don't have really any preference, and I think I'm very happy as an immigrant, because when you want to immigrate, you are thinking about the where do you want to live in the world. And I think if I want to decide another time for an immigrate, for for a place to immigrate, it would be also Montreal. I will keep my choice.
You would do it again. That's
Yeah.
beautiful.
Yes, and then when you visit the dentist, what kind of patient are you?
I think I'm a good patient. I'm quite
Yeah.
calm. But as a dentist, also you ask, you want, and you have your own opinion. You may not accept everything that they say to you. But I'm a good patient. I don't complain. I try to keep calm and be very collaborative with
Yeah.
my dentists.
Do you come with your own treatment plan? This is what we're gonna do today.
Yeah, but there is no choice. You have to discuss. You have to discuss, and that is also evidence-based dentistry. At the end, is a patient that has to
Definitely.
select their treatment plan. So
Yeah.
that I see also as a right for the patient. So
Mm-hmm. For sure.
Definitely. And it's also, I think it's important to mention that today is this month is Oral Health Month. Did you want to say any words on that?
I would like just highlight the importance of oral health and our role as a citizen, as a policymaker, as a professor, as a researcher, as a student to advocate for those who don't have really access to care. And so this is my short message from for Oral Health Month. I have done a small video clip that I think it is on video YouTube for this month, and the message was really that just we have to be aware of the importance of oral health and how it impacts really the general health and the well-being of everybody.
Yeah, and
Definitely.
we're gonna link the video in our podcast, and also I think it's important because McGill does a lot of work to combat the inequalities when it comes to oral care, because it's not free in Canada and a lot of people can't afford it, and I think it's
Yeah.
important to highlight that.
Exactly. So, our service to the community program is a very unique program through which we are providing dental free care or care with a reduced cost to many people who are in need. Because at the end, everybody should smile. Everybody
Mm-hmm.
merits to have a smile, and
Definitely.
we are very very happy to have a good supporter for this donators that they are really helping us. And as you know now, we have three very good different services with that we are covering different population that they are in need: elders population, those who have a disability, physical disability and mental disability. So I'm very, very happy for that. And we have two dans ma projet. So one is dans ma maison. This is our new project. Another one is dans ma communauté, which is the EDI project. And then dans ma région, that is also one of my own project for rural and remote. So we'll continue on that. And thank you very much for this amazing interview. And I like always to be with the students and with young people. That keep me young, and I like this.
Thank you so much for being on, Dean Emami. We really enjoyed having you. And just to leave it off, a couple last words for our viewers is, what advice would you give to future applicants, just to close off the podcast?
So everybody who wants to apply for dentistry, and I say for McGill, if you want to become a student at McGill University Faculty of Dentistry, you can do. It is not impossible. You have just to work hard. And also you have also at the same time, look at the value of our faculties when you are preparing yourself. So in this faculty, is not only your GPA. During your interviews, you will be challenged for your community activities, the importance that you put on the communities, and also for the ethics. So, and everybody, I think although we have a small program, but just do not be disappointed if you don't get the first time, second time. Keep on going, come to McGill, and you will reach there. And as you did, Ami, maybe you have to give them a message to the students.
I think that honestly, that's exactly what I would have wanted to hear while I was applying, is don't give up and keep trying, because you will get there as long as you stay focused on your dream.
Exactly.
Definitely. Mm-hmm. Thank you so much, Dean Emami. It was a very big pleasure. Thank you so much.
Happy Easter.
Yes,
Happy Easter, everybody.
Thank you. Bye-bye.